Okay. So, good evening, everyone. So, my name is Kay, and together with my teammates, we're going to be introducing our pitch, which is also on homelessness, but we are calling it Access, connecting people to help whenever they need it most. Okay. So, here are the contents that we'll be covering today. So, first is the problem statement, why is this actually happening? Second is our solution, how we intend to solve it. Third, our target audience, who we're building this for. And finally, our research, what's already been tried and where it falls short. Now, let's start with the number 7,862. That's the amount of homeless individuals were recorded in Malaysia between 2021 and May 2025 of last year, according to New Straits Times. Now, that isn't just a statistics. That's the amount of people who, on any given night, may be within walking distance of a shelter, a clinic, or a meal, and simply not know it. So let's ask the obvious question: why is this happening? Okay. Now the information exists. It is scattered across Facebook, NGO websites, WhatsApp groups, and government portals, but this creates a major access problem. Now, first is no phone and no data. Smartphone apps and QR codes assume a device and data plan that many simply just don't have. Next is the literacy and the language gaps. Now, dense text or even English-only signage exclude people who needs it most. And last is the mistrust of institutions. Now, this can be due to past experiences with systems that make people more unlikely to trust a familiar face than a form. Now, most outreach efforts fail because they assume a device or a level of trust that this population often doesn't have. Now, why this problem matters? Now, without timely access to information, these individuals may end up sleeping on the streets despite available shelter beds, missing free meal distributions, delay in seeking medical health care, and go untreated for mental health issues or miss opportunities for financial or employment assistance.
Okay. Hi guys, my name is Doreen and now I'm going to introduce about our solutions. So Access is not only a mobile application or website, instead it is a shared information system that will provide the same information through several different channels. So Access will use the one shared directory containing information about the shelters, clinics, food, assistance, and hotlines. So this information is then delivered through 6 different channels. The first is a pocket resource card. It is laminated, multilingual, and use simple icons. Outreach workers can distribute it directly to people on the streets. And the second is a printed community directory. It is organized by district and placed at shelters, clinics, libraries, and police beat bases. The third is a toll-free voice hotline. For example, callers may press 1 for shelter or 2 for food. It can be used without a smartphone or mobile data. The fourth is a human resource navigators. These are peer outreach workers who carry the directory and answer the questions face-to-face. The fifth is the notice boards at the public hubs, such as train stations, hospitals, and community centers. The main information is printed clearly, while QR codes will remain optional. And finally, the library information corners will provide leaflets, assisted search codes, and access to free internet. Although the formats are different, every channel provides information from the same shared directory. Okay, the next. So next we'll explain our target audience. Our target audience is divided into 2 groups, the primary target audience and the secondary target audience. So our primary target audience will include homeless individuals, people at risk of homelessness, the urban poor, and individuals seeking mental health support. So these groups may experience barriers such as limited internet access, language difficulties, and mistrust for the formal institutions. Then our secondary target audience includes NGOs, volunteers, social workers, and also government agencies and the donors. They play an important role because they can provide the updated service information, distribute the resource materials, and connect individuals to suitable assistance. So therefore, Access do not replace existing organizations. Instead, it connects these organizations and makes their service easier to find. Then next, I will move on to our teammate.
Hello, could you guys hear me? Hello.
And can.
All right.
Yes.
Sorry, I'm scared I muted myself. So my name is Sing. I'll take over from the research part. So is there any predecessors or any existing firms that tried to help before? The answer is yes. So basically that businesses, community groups, and even NGO have actually attempted to do this kind of operations without relying on the internet, basically physical asset. So take a look at Pertiwi Sukichen, Kechara Sukichen, Anjung Singa from DBKL, and even the Care Malaysia Hope. So they try to provide food banks and even shelters. However, as you can see from throughout these four different distribution channels, we notice that they are providing physical assets to the homelessness, but our issue right now is that they don't have the navigation access to this specific food bank. So it exists, but the homeless people that are in need have no clue they are organizing this kind of event. So yeah, this is the issue that we're currently trying to solve. And how do we promote this kind of distribution channels to the homelessness? By using posters, sample posts, because we may not know whether homeless people may have access to internet, some, and even a one pager for collaboration and stakeholders towards the business. So first up would be the poster. This is like a simple poster. We're trying to run an advocacy campaign, so to raise awareness throughout the community that homeless people needs help as well. So the venue will be university, yeah, help university. So basically trying to raise the campaign ourselves. And next up, this would be the sample post on social media such as like TikTok, maybe Facebook and Instagram, etc., wherever possible to promote this kind of campaign. And lastly, a one pager to very likely to get a partnership proposal towards like businesses or corporate firm that may have interest in helping the needs. So small acts, but it will make a lasting change towards the people in need. And yeah, that will be all. Thank you for our team.
Thank you so much. Right. Thanks, team number the second group to present. I was just about to ask you guys what did you all use to create the slide. I saw it. I kind of guess it was Canva. Yeah. So well done on using AI to to do some of these things fast. Not only fast, but I think you've done it well. The posters and stuff like that. It was a very short amount of time. I think you guys only had less than 30 minutes before you all started on the poster, maybe, I'm guessing. But yeah, I think nice, good potential. Very good narrative as well. Okay, good job. Let's go and get the next last team from Help University. Our last team from Help University would be team number 2. Team number 2, over to you.
Give me a moment. I'm gonna share screen.
Yeah.
Is my screen visible?
Yes.
Yes. Okay. So we're gonna start without further ado.
Right.
Good afternoon, everyone. We are Group 2, and today our topic is about mental health in workplace, especially on the mental well-being of employees in the workplace. And our specific angle of view in this is early intervention and the prevention from burnout to decline of the decline in mental health and their well-being of the employees. So our mission statement is to empower every employee with free mental health support by integrating a well-being tool to foster productivity and good health. So this is made through our web application that we will show later on. So our goals is to enhance work performance such as productivity and completing work by deadlines on time, to reduce the stress and burnout of employees, and to increase job satisfaction, such as like the workplace environment and so on. Our problem statement is, so in Malaysia's urban workforce right now, there's a statistic that 67% of employees report feeling burnt out, and they often experience decline in mental health. So these are the concerns that are arising nowadays. So these concerns arise due to the fact that they have deadlines and pressure from their superiors. But despite the fact that counseling and counseling and therapy are available, there's a stigmatism and there's a lack of awareness that these things are available. So that is why there's a lack of integration with a workplace environment to prevent these kind of problems, such as decline in mental well-being. So what is our solution to these problems? So our solution is to provide emotional support for them. So our web application, does daily wellness check-ins. The psychological effect that this brings for the employees is that we can predict how burnt out they are with explainable insights with our AI. So the social conduct for this is that it will be privacy by design and it will not be disclosed. It will only HR and certain individuals will know the privacy matters on this. Yeah. So moving on to the features of our application, we will have a daily check-in feature, an AI wellness coach, a burnt out prediction engine, gamified wellness to keep it fun, and virtual counseling if they want. So I'm going to share screen our web application now to showcase. Are you guys able to see this? It's called MindSync. Yes.
Yeah. Visible.
Okay. So if we press get started, it will show how are we feeling today. So how is the employee feeling today? If they're feeling awful, and what's their energy like? They're very low on energy. They are very stressed or they are very overwhelmed, and their workload is too heavy. So let's say I'm going to write a few words about my thoughts and my feelings. So I'm very stressed because of deadlines. So this will show that my wellness index is very, very low. And it will tell me it sounds like today is very heavy and that booking counseling is preferred for me in my situation right now. So we can demo. So here, it's very cheap for counseling, or it may even be free for custom ones. So that's all for our web application. I'm going to pass this presentation on to my groupmate Harin.
All right. To talk about the question of whether this problem is well documented and who has already tried to solve, let me go into the statistics part. So next slide. Right. So to be honest, the mental health the mental health awareness among the employees are well documented. Because if we see the numbers, we have spent about 14.46 billion estimated. It's an estimated amount that is yearly the cost of poor workplace mental health to the Malaysian economy. And about 67 of Malaysian employees reported feeling burnt out in 2024. And about 5 to 8% is the median utilization of traditional employee assistance programs, a number that has barely moved in decades. As for 2026, Malaysia's Flexible Work Safety Guide now legally requires employers psychosocial risk assessment. And apart from the numbers, there's also self-stigma, which is the single strongest predictor of not seeking mental health to help among Malaysian employees. The global digital mental health market is also valued near to USD 19 to 20 billion in 2025 and is projected to reach 45 billion by 2030. This is not a fringe problem, and employees that are guessing about it. So what's still unresolved or not, looked at clearly? While the documentation problem the documentation of the problem is strong, the documentation of which interventions actually work is much thinner and more contested. So in other words, while the problem is there and people are researching more and more about it, how well are we addressing that problem is not out there yet. We still don't know what is the effective way to curb the employee burnout and whatsoever. So most Malaysian solutions to date are also overpriced and marketed towards larger employees and like MNCs and all, leaving mid-market or small businesses, business workforces underserved. So the next one, for the question of who tried to solve this and what has happened, four approaches have been tried, and the pattern is inconsistent. Separation and friction fail, but the integration works. So for the traditional EAP, Employee Assistance Program, it is stuck at 3 to 8% utilization for decades due to stigma and friction. There is still those stigma and stereotype where if I go seek therapy, something's wrong with me and all of it. So this has prevented employees from going and seeking mental health initiative to help themselves. And in terms of gamified wellness programs, it has boosted short-term engagement, but the most rigorous trial found no real effect on health or productivity. So some of simple gamified wellness program did for a short time, it did give the employee motivation and so on, but it does not solve the long-term productivity issue. There's also some VC-funded platforms like Lyra Modern Health. It proved demand, but standalone apps struggled because the winning move was integrating it directly into HR systems like Workday, because you would get more context of the work, the employees' workload and so on. So there's also some Malaysian platforms such as Naluri, Thoughtful, and Saiho. It is effective, but it is priced. It's a pricey, so only large employers can afford this. So, in conclusion, every failed attempt shares one root cause of asking employees to go somewhere separate, and every reason success comes from removing the separation. Yeah, next slide. So this would be our promotional material. So it actually, our solution's name would be MindSync. So our code is empowering workforce wellness anonymously. So some of the features of our solution would be the employee dashboard. So the employer, and both employer and employee will have a dashboard to see their overall mental health status and everything. And we also have a AI wellness coach. So it's a personalized chatbot that can provide wellness tips or journaling prompts or whatever methods that the employees can use to further enhance their productivity and so on. So we have also included gamified challenges within the application and have to boost the motivation of the employees. We have tied it with rewards, more like how Lapa gives rewards for completing missions and everything. And one of our strongest feature is also privacy preserving HR insights. So we want to make sure that because mental health is something still sensitive, so the solution, the insight should not be publicized or whatsoever. So privacy is our promise, and only HR only can see aggregate data, and they cannot see individual journals or counseling session insights. And this is in line with a lot of global standards out there. So with that, we would like to end our presentation. Thank you so much for listening to our pitch. For more information, you can just visit our company website. Thank you.
Wow. Is this website live?
No, the website is not live. It's we created the prototype that we showed just now. That is a live virtual link that we can share in the chat.
Fantastic.
But
what did you use to code that?
We used Claude to code that.
Yeah, Claude's always good at coding, right? Was really
because
good.
we had to do it fast, so we just used that.
Yeah, it is a personal artifact on Claude. It's not hosted out of Claude, right?
It is hosted in after getting all the codes and everything, we hosted it in the Vercel application.
Vercel. You all went to Vercel?
Yeah. Yes,
correct.
Okay,
very cool. Wow, nice.
So the website is actually live. You can go click the link.
Beautiful. Beautiful. Yeah, you all went to Vercel. Okay, very good. Yeah. Amazing stuff, right? Less than 1 hour. Look at that, right? This is what I call human innovation powered by AI. Okay, without further ado, let's because it's 4:45. Let's pass the time to our last but not least, okay, the STAT College, who have been the minority in this competition, and they are our group and our friends from Penang. In fact, today alone on the Zoom chat, we are all quite far apart. I'm here in Singapore, right? You got in Kuala Lumpur, and then you got in Penang. So you can shape the tree together. We're all quite far apart. So this that. Looking forward to hearing your presentation. Take it away. Catherine, we can't hear you, Catherine. I think I'm not sure whether I'm the only one who can't hear you, but I see your lips moving, but I don't hear a voice come out. Am I the only one? Can you guys hear Catherine?
No.
Okay, so that means Catherine, your voice. I know you started strong because I could see you were starting strong. Then man, I can't hear. Yeah, still can't hear. There's something
Hello,
there.
everyone.
Yes,
Can you hear
yes.
me?
Now it's good. Now it's good. Okay.
Okay, so good afternoon, everyone. Our team today will be presenting our project, the title, The Help Right in One Place. So our project focus on a challenge faced by many vulnerable individuals in Kuala Lumpur, finding the right support service during the time of need. So our teammate, we have me, Katrini, and also we have Neo Wei Kang, Dia Jin Wei, Law Wei Jun, Ruben. Okay, so let's begin by understanding the broader social issue behind our project. So, homelessness, urban poverty, and mental health are closely connected challenges in Kuala Lumpur. So people experiencing these difficulties often face multiple problems at the same time, including lack of safe accommodation, food insecurity, limited healthcare access, unemployment, and emotional distress. We realize that solving all of these issues would be beyond the scope of a university project. Instead, we choose the focus on a specific and manageable problem that could make a meaningful differences. So the problem we identified is that homeless housing insecure individuals often struggle to find a correct support service for their immediate needs. Information is scattered across organizations. So people are often insecure or unsure where to go, who to contact, and whether they are qualified for assistance, or even whether a service is open. For many vulnerable individuals, complicated websites, forms, and language barriers make the situation even more difficult. As a result, users face fragmented and hard to navigate information. So I will pass to my teammate to explain more about that.
Hi, good afternoon, everyone. Can you hear me? Can. Okay. The problem research and evidence. Malaysia has 189 social assistance programs across 26 agencies, making support difficult to navigate. And the link is below there. Second, many low-income individuals rely on friends, family, or social media because official information is fragmented, and the link is below. The third is mental health issues such as anxiety and depression are common among homeless population. So this is the evidence the problem exists. 440 homeless individuals observed only in Kuala Lumpur in February 2024 and 7,862 homeless individuals taken in by JMK National worldwide. 1,742 cases recorded in Kuala Lumpur from 2021 to May 2025. 1 million Malaysian ages 16 and above experience depression. Why is this problem worth solving? To use a service, a person first needs to write information such as location, free or paid, document needed, walk-in appointment, emergency contact. People cannot use a service when they do not know that it exists or how to access it. First step, information gap. Second step, delay assistance. Third, great personal risk. Who are we helping? Direct user, primary audience, homeless adult living on KL streets. Housing insecure individual families. Low income urban resident at risk. People with limited digital access. Support networking. Secondary audience, social work, cases officer, NGO volunteer, community leader, healthcare and mental health workers, food bank and soup kitchen staff, and government support officers. Next slide, I pass to my teammate.
Good afternoon, good evening, everyone. We introduced the One Tap Help MY, a mobile-friendly directory connecting individuals to immediate help, accessible via QR codes, website, or WhatsApp line. It requires no registration, is fully multilingual, and is supported by local volunteers and printed cards. The directory provides 5 verified categories: safe, shelter, food and essential, healthcare, mental health support and welfare, or job assistance. This consolidates critical scattered resource into one single trusted point of access. The user journey is simple. Scan the QR code on any poster, choose the category matching your immediate need, and find nearby verified help. For example, selecting the safe shelter instantly shows local housing info, direction, and hours. And next, we will pass to Wei Jun to present.
Okay, good evening. In inclusion designed for different users to make sure One Tap Help MY is accessible to everyone. We will build the service around inclusion and privacy. And the first one is multi-language and clear. We support 4 languages: Bahasa Melayu, English, Mandarin, and Tamil, using simple sentences and visual icons. So information is easy to grasp immediately. Second one is instant and private. No account registration is required. User get instant mobile access while keeping their data minimum and secure. And third one is offline access for user without smartphone or stable internet. We offer support through volunteer assistance and physical pocket card. And the last one is core goal. Every interaction with this service should be easy to use, respectful, and non-segmentation. Next. Methodology. How we will validate the solution. To ensure our platform genuinely meet community needs, we ground our design in through research and continuous testing. The first one is research strategy. We combine primary research such as interviewing social worker and surveying food program participants with secondary research across government, directories, NGO database, and academic students. key question, we focus on identifying user barriers, finding the most urgent support categories, building trust, and choosing the best content format. Interactive process, we follow a 4-step cycle: research, design, test, and improve. Quality assurance, every piece of service information is strictly verified with partner organization before publication. Next, outreach, how we will reach the target audience. Our outreach plans focus on meeting people where they already are. Key location, we will promote across high footfall community hubs, including soup kitchen, food banks, public hospital, PPR housing communities, transit station, and library. Promotional tools, to reach different user groups, we will deploy 6 target materials: A4 poster, social media posts, pocket cards, QR sticker, volunteer info sheet, and one-page guides. Call to action. Need help today? Scan, choose, and find the right support. I will pass to my teammate.
This is our main promotional poster for One Tap Help MY. It is designed for the clinic, food bank, NGO center, and public transport station. The large headline quickly attract attention while the 5 icons show the different type of support available. The poster also explains the process in 3 simple steps: scan, choose, and find nearby help. We include the both QR code access and volunteer assistance so that the solution remain accessible to users with different digital abilities. We use AI to brainstorming and narrow the problem, organize our research, simplify information, and improve multilingual wording. It also helps us create the presentation, poster, and prototype concept. However, we also review the information and make the final decision ourselves. AI support our work, but it did not replace human judgment. We identify 6 main challenges: limited smartphone access, outdated information, low literacy, language difference, privacy concern, and emergency. Our response include printed material, volunteer assistance, regular verification, simple multilingual content, minimal data collection, and clear emergency instruction. This help make One Tap Help MY more inclusive and trustworthiness. In conclusion, our One Tap Help MY focus on one practical problem, which is difficult finding the correct support. By combining verified information, digital access, printed resource, and volunteer help, the solution make essential service easier to find out and understand. One scan can become the first step towards safety, support, and stability. Thank you, and we welcome your question.
All right, thank you so much, Team Distat, for your last presentation. Okay, so I think it's a fantastic idea, right? One-stop service, one scan, and then you get all those things in. It's really good. Thank you so much, Distat. Okay, ladies and gentlemen, thanks for your presentations. We are running out of time. It's 5. I don't want to hold you guys